So let's talk about, besides eye drops, something else that can be used to treat glaucoma. And that's a laser procedure. It's becoming either a first and sometimes second line treatment. So this is a cutaway of the eye here. And so as you can see, this is the ciliary body here. The fluid is made. This is the lens in the eye. The iris is the color part of the eye, and then this is the cornea that domes over the iris, the color part of the eye. Well, the fluid is made in this anterior chamber. It comes out through the pupil into the iris and then drains in this trabecular meshwork. Now, this trabecular meshwork is like a sponge. And so what they can do with a laser is almost like you're taking a sponge and punching a hole through it. If you punch a hole through that sponge, of course, now fluid can drain through that sponge with much less resistance. And so that's what they do with the SLT laser. Now, in the old days, they used to do that laser with a hot laser, and it would actually put holes in the trabecular meshwork, that sponge-like material, to make the eye drain better, but it would end up scarring. And so they could only do that procedure once or twice. Now they use a cool laser and they can repeat that. So if it works and it's working well for a year or two and then it stops working, then they can repeat that process. Some of the latest technology that they're looking at for glaucoma in research and in treatment is, how does the optic nerve get perfused? So what does that mean? Well, think of the optic nerve, and it's the entry and exit point for the blood vessels in the back of the eye. And so for the retina to be nourished, you have to have good blood supply. You have to have good oxygenation of the tissue. That's kind of hard to say. So you've got to get oxygen to the retina. Well, if you have bad blood flow, if you have bad oxygenation of the tissue, that can make your glaucoma worse. Patients that have sleep apnea tend to have worse glaucoma. Their glaucoma tends to get worse faster. Patients that also have really low blood pressure, patients that have cold extremities, they're not getting the blood flow to their extremities, therefore they're not getting the blood flow, blood supply, and therefore oxygenation to the retina. Their glaucoma can be worse. So some of the newest studies are looking at blood flow. How can you increase blood flow? We used to say, you can't really do anything to help glaucoma from a nutrition or an exercise. But now we're finding out that if you get your blood flowing, if you get your heart rate up, if you exercise regularly, it actually can help you with your glaucoma treatment. But eye drops are the mainstay right now. We've got the eye laser surgeries that work really well. And then for patients that get further down on the glaucoma, have had glaucoma for a while, sometimes they need other surgeries where they can actually go in the eye and create an exit point directly from the inside of the eye to the outside of the eye to drain the eye pressure. So great technology that's been around, great technology that's coming. So if you need to come in to get your eyes checked for glaucoma, we can do that, and we can see if one of these new technologies would be beneficial to you.